Hi everyone, welcome. My name is Brittany Sartain and I'm here with Dr. Charles Keith. He's one of our bariatric surgeons here at the UT Health Tyler Bariatric Center. November is Diabetes Awareness Month, so today we're going to be talking about bariatric surgery's effect on diabetes. If you have questions, feel free to comment them below. I'll be checking that periodically and we can get those answered for you. So let's get started. Our first question is, what is type 2 diabetes and what causes it?
Well, thanks for coming to talk with us today. Yeah, that's a great question. I think it's important that we start with that because everyone seems to know somebody with type 2 diabetes or may even have it themselves, but you know the complications that arose from their type 2 diabetes, but don't necessarily know what diabetes is. So in simplest terms, diabetes is when your body just is not able to regulate the amount of sugar or glucose that is flowing through your bloodstream. And so how that occurs, especially in type 2 diabetes, which is what is most likely to be associated with obesity, is that your body does not respond to a hormone called insulin like it should. So insulin is a hormone made by your pancreas, which when you eat something, you have a lot of sugar in your bloodstream, the insulin goes to the cells and says, take this sugar up, use it as energy. But what happens with type 2 diabetes is your body doesn't respond to that insulin like it should, so your blood sugar stays high.
Okay. So what are the risks of living with type 2 diabetes?
Yeah, there are numerous risks of living with type 2 diabetes. So importantly, all of them are important, but there are a lot of heart risks. So coronary artery disease or heart disease, which can lead to heart attacks and heart failure, death from heart disease, leads to strokes. It can lead to kidney failure, which means going on dialysis and needing potentially a kidney transplant. There are several nerve problems and foot problems, so people get wounds on their feet that are unable to heal. And then also eye problems that can lead to blindness down the road.
Okay. One question we had come in here is, what are the initial signs of diabetes?
So initial signs may be something like fatigue. You may have some excess urinating more frequent than usual, feeling thirstier than usual. Those are kind of the first signs that people have before they're ultimately diagnosed. And so if you experience any of those kind of symptoms, I recommend getting in touch with your primary care physician to let them help sort that out.
Okay. What would you say are the typical treatment options for type 2 diabetes?
And so the typical treatment options are going to be mixed between oral medications and injectable medications. So for people who are typically earlier on in their course of their diabetes, their disease process is still fairly new, they may be able to control their blood sugars with just pills, which is great. Ultimately, that disease process is probably going to develop further, and it's going to require injecting medicines like insulin several times a day, and including monitoring blood sugar levels throughout the day by pricking a finger.
Okay. So how can bariatric surgery help?
So that's the golden question, how it helps. Mm-hmm. The great thing is we know that it does help, but experts around the world still debate on how it helps. And it really is coming down, there are several ways that it helps. We just haven't settled on exactly which ones are the most important. But for example, there are several hormones in your body that are exaggerated after bariatric surgery. And some such hormones make your pancreas produce more insulin. They also make your tissues in your body respond to that insulin better. There's also some theories that there are some hormones that are naturally made in your body that are actually have harmful effects as far as diabetes goes that aren't made as much after bariatric surgery. Okay. And there's also a lot of research now going on into the actual natural bacteria that live inside our intestines. Mm-hmm. The composition of those bacteria actually change after bariatric surgery, and there's a lot of thought that maybe that contributes as well.
Mm-hmm. So, do you think type 2 diabetes can be cured from bariatric surgery?
So, it can definitely be made better, but cure is not necessarily the word we use because cure implies that diabetes goes away and it will not come back. So there is always a risk that it does come back over time. And so the word we use is remission.
Okay.
And yes, it absolutely can be put into remission. And we have very high level studies that show that patients with obesity and type 2 diabetes that have that undergo bariatric surgery compared to the ones that don't undergo bariatric surgery have a better chance of going into remission as well as just getting control of their diabetes.
Okay. So how long does it usually take after surgery to see an improvement in diabetes?
Yeah, that's a great question. And you would think that it's the weight loss that leads to the diabetes getting better.
Mm-hmm.
But what's really incredible is that actually within just a few days of bariatric surgery, you can see the diabetes get much better.
Okay.
Talking somewhere 3 to 5 days.
Oh, wow. So does anyone with type 2 diabetes qualify for bariatric surgery, or are there other certain requirements?
So this is somewhat of a tricky question because qualifying for bariatric surgery is typically something that is dictated by insurance companies.
Okay.
And so it's different than would they benefit from bariatric surgery. So there's a lot of data that shows people with a body mass index or a BMI that is lower than what would typically qualify for bariatric surgery based on insurance do get a benefit from bariatric surgery from a diabetes standpoint. But in general, we still use a BMI, and if you not familiar with the term BMI or body mass index, you can go into Google and type in BMI calculator, and basically what it does is gives you a number that relates your height to your weight.
Okay.
Because somebody who weighs 300 pounds who's 5'5" is different from somebody who weighs 300 pounds and they're 6'5".
Right.
And so what we use is a BMI of 35 or higher is typically what will qualify for most insurance companies.
Okay.
But fortunately, we are seeing several health systems, including Cleveland Clinic, where I did my bariatric training. Their employees, they cover bariatric surgery for anybody with diabetes who has a BMI of 30 or higher. So I do think this is going to spread, fortunately, and more people will be able to be covered by the insurances.
Awesome. Do you recommend bariatric surgery for patients who have prediabetes?
Absolutely. So one of the other great things we know about bariatric surgery and diabetes is that the earlier in the course of your diabetes that you have surgery, the better chance of getting a good durable benefit from it and putting it into remission. So those are the best ones. And I've had several patients come in just recently who were diagnosed with prediabetes, a week or two before, and that was enough to get them to come in and see us.
Mm-hmm.
Now, that's not saying that people who've had diabetes for a long time aren't going to get any benefit, because they will.
Right.
But it is harder to get a good long-term benefit if you've been on insulin for 18, 20 years versus somebody who's not yet on insulin and was just recently diagnosed.
Okay. So we've been kind of talking about type 2, but is there any effect of bariatric surgery on patients with type 1 diabetes?
So there's very limited data on type 1 diabetes. There are very few studies out there that are small studies too. We're talking about 20-something patients. Mm-hmm. So in those very limited studies that we have, yes, there is some suggestion that patients with type 1 diabetes will get a benefit of at least decreasing insulin requirements, but there's not enough good data out there to really endorse it.
Okay. Let's see. Okay, our last question here is, what is your overall goal for your patients?
So my goal for my patients is to help them meet their goals, and that's what's important in bariatric surgery, because I like to talk with my patients and find out what their road was to get to this point to come see me, because everybody's different. Nobody really wakes up one morning and says, hey, I'm going to go talk to a bariatric surgeon. They've gone through several life experiences and they have different goals. Some people are coming in because they have terrible hip, back, knee pains and may need a knee or joint replacement, and so they want to get weight off to help alleviate those pains, and so their ultimate goal is to get as much weight off as possible. There are some people that come in because of diabetes and they understand the risk of having diabetes long term, and so we can tailor a plan that will help them reach that goal. Some people come in because they have new grandkids that they want to be there for, their own children they want to be there for long term, and so everybody's goals are different, and so I guess my goal is to help them reach their goals, and I think that's why it's important to come in and talk with us, and we can see what the patients are really wanting to get out of the whole process and tailor a plan to meet that goal.
That's awesome. Well, those are all the questions we have. So thank you everyone for joining in. Dr. Keith, thank you for your time.
Yeah, thanks for joining.
If you would like to learn more about the services offered here at the Bariatric Clinic, you can visit tylerbariatrics.com. Thank you.